The second image based questions is the muscles of mastication and what are its functions. With respect to muscles of mastication, first muscle that will be present on the external side is called as masseter. First muscle that is present on the external side is called as a masseter. And if you look at the direction of these fibers, the fibers are directed forwards and upwards. Forward means in this direction, upward means in this direction, and the together effect is this one, that is forwards and upwards. The forward movement is called as protraction and upward movement is called as elevation of mandible, also called as, if the mandible is elevated, nothing but closing of mouth. So it's also called as closing of mouth. So just remember the mnemonic here as MPC. M is masseter, P for protraction, C for closing of mouth. Next muscle of mastication is temporalis muscle. This muscle is called as a temporalis. Look at the fibers direction. The majority fibers direction are towards upward direction, but some fibers are present towards the backward directions, the posterior fibers. So the upward movement of the fibers is called as elevation, also called as closing of mouth, and backward direction is called as retraction. So just remember the mnemonic here as TUB. Mnemonic is tub. First mnemonic for the masseter is MPC, and the mnemonic for temporalis muscle functions is upward and backward. Upward is called as elevation of the mandible, also called as the closing of mouth, and backward side is called as retraction. And this retraction is done by particularly the posterior fibers of temporalis. Posterior fibers of temporalis. Next, coming to the, if you remove the ramus of the mandible, this is the ramus of the mandible, and if you remove a part of the ramus of mandible, then you can see two muscles. The upper muscle is called as lateral pterygoid. The upper muscle is called as lateral pterygoid, and the lower muscle is called as medial pterygoid. So what will be the functions of these? Is first come to lateral pterygoid. The lateral pterygoid muscle fibers are towards the forward direction and downward direction. Forward direction. The forward direction is called as protraction of the mandible, and the downward movement is called as opening of mouth, also called as depression. Depression of the mandible. The mandible will be going downward, that's called as depression. Also helps in opening of mouth, so it's called as opening of mouth. So it is only muscle that helps in opening of mouth is lateral pterygoid. And the mnemonic here to be remembered is, you might have heard about loss of pay, LOP. Loss of pay. LOP is the loss of pay. Or you can remember pole, whichever is convenient for you. And look at the direction of the fibers of medial pterygoid. Is the medial pterygoid is just like the same direction of masseter. So what is the function of masseter is protraction and closing. So in the same way, medial pterygoid is also having protraction and closing with the mnemonic of MPC. So protraction and closing of mouth, MPC. The mnemonic is MPC. So MPC, tub, and loss of pay, LOP. If you remember these three mnemonics, all the muscles of mastication and its functions will be the easiest. The three mnemonics. I'll be highlighting that. PC, tub, loss of pay, and again MPC. M is either medial pterygoid or masseter, having the same functions of protraction and closing of mouth. This is the image-based question of the transverse section of the brain. Transverse section of cerebral hemispheres. In that, we have the cavities on either side of the midbrain, on either side of the midline. This is the midline. On either side of the midline, we have the cavities. Those cavities are called as lateral ventricles. and the cavity which is present almost in the middle or the midline is called as a third ventricle. Now lateral to the lateral ventricle we have the gray matter called as caudate nucleus. But lateral to that of the third ventricle we have another gray matter that is called as thalamus. And this wedge shaped structure is called as lentiform nucleus. Lentiform nucleus. And this lentiform nucleus will decide the capsules. If any white matter internally present, it is called as internal capsule, and any white matter that is present externally is called as external capsule. So we'll take with a different color. This entire is called as internal capsule, which I am highlighting with blue color, and this entire structure which is in this is called as external capsule. So internal capsule and external capsules is based upon lentiform nucleus. And further lateral to the external capsule we have the gray matter. This is a lentiform nucleus, this is the internal capsule and this is the external capsule. Further laterally we have another gray matter, and that gray matter is called as claustrum. These are the sections that can be, what are the identification, the images in case of TS of the cerebrum, transverse section of cerebrum. Okay. Next, so first has to go from midline to lateral. On either side the cavities are called as lateral ventricles, and lateral to it is called as caudate nucleus, whereas the midline cavity is called as third ventricle and lateral to it is called as thalamus. Next, the wedge shaped structure is lentiform nucleus. Internally is internal capsule, externally is external capsule. External to the external capsule there is one more gray matter is present, and that is called as claustrum. Next part, image based questions regarding the pharyngeal arch arteries. When we had discussed regarding the pharyngeal arches today, the pharyngeal arches are total 6 in number, in that 5th will be degenerated. In the same way, in each arch one artery is present, they are called as the pharyngeal arch arteries. These pharyngeal arch arteries are also 6 in number because pharyngeal arches are 6, out of which 5th arch is degenerated, so 5th arch artery is also degenerated. So you can see here, first arch, second arch, third arch, fourth arch, 5th and 6th arches. The same on the other side. So on the right side, on the left side. So on the right side, on the left side, what will be the fate in the adults? The first arch on both right side and left side will form maxillary artery, but they will degenerate. The second arch on both right side and left side will also form hyoid and stapedial arteries. They also degenerate, and hence the questions will not be asked at these two areas. Next, coming to third arch artery. The initial or the proximal part will form common carotid artery, and the distal part will form the internal carotid artery. The proximal part will form the common carotid. The distal part will form internal carotid, both on right side and left side. So there is common, right and left. Then what about external carotid artery? External carotid artery is not derived from the third arch, but it forms like an outgrowth in both right and left side. So first arch maxillary degenerate, second arch hyoid stapedial, they also degenerate. Third arch proximal will form common carotid, distal will form internal carotid, and external will form as an outgrowth. They will persist. And coming to fourth arch on the right side will form subclavian artery, and on the left side it form a part of arch of aorta. As right side and left side both are different, so hence the questions are maximum at the level of fourth arch artery. What is the right side derivative? Fourth arch artery, left side derivative. And fifth arch is completely degenerate, so there is no derivatives of arteries also. And coming to sixth arch right side proximal will form right pulmonary artery, left side proximal will form left pulmonary artery. So there is a symmetrical for the proximal part, but distal part is degenerated on the right side, but on the left side it forms a duct, and the duct is called as ductus arteriosus. As there is a difference in the distal part of sixth arch artery, and hence this is the most commonly asked. So most commonly asked is regarding the fourth arch artery, because right side and left side are different. In the same way, sixth arch artery distal part, the right side distal is degenerated and the left side distal will forms ductus arteriosus. This is what the derivatives, and this table has to be pasted in your reading chamber wherever you are sitting. The study chamber is there. It is mandatory to touch, because the first preference on the embryology topic to ask the questions is this one: pharyngeal arches or pharyngeal apparatus or pharyngeal arteries. Next one. The next image based question is regarding the heart showing different arteries. Now what are these arteries are? The artery which is present towards here on the right side is called as right coronary artery, and towards the left side it is running is called as left coronary artery. And left coronary artery has two branches. This is called as left anterior descending artery, and this is called as left circumflex artery. So these are the arteries that can be remembered, and only one part regarding the posterior part we have the posterior part of the heart, that is called as coronary sinus. So these are the image based questions that will be present in case of heart. Next, coming to image based questions regarding rectus sheath. So in this, the anterior wall of the rectus sheath is removed. Once the anterior wall of the rectus sheath is removed, then you can see a muscle. This muscle is called as rectus abdominis. Rectus abdominis. And if you remove this rectus abdominis, then you will see this is called as the posterior wall of rectus sheath. And this posterior wall of rectus sheath will not be present throughout, and it will be ending in a arc shaped line, and that is called as arcuate line. And there is one small triangular shaped muscle is present here. Can you see here? I'm zooming the image. Can you see the small triangle shaped muscle here? This muscle is called as pyramidalis. Pyramidalis. What is the nerve supply of the pyramidalis? It was asked in once. It is T12, that is a subpostal nerve that will be supplying for pyramidalis. Next. The next image based question is regarding the anatomical snuff box. So anatomical snuff box is actually present between abductor pollicis longus and extensor pollicis brevis on one side, that is on the anterolateral side. Whereas on the posteromedial side we have extensor pollicis longus on the posteromedial side. Between these group of tendons, on one side two tendons are present, the other side the other tendon is present. Between this group of tendons, can you see a structure, a space is present, and this space is called as anatomical snuff box. This space is called as anatomical snuff box. What will be so on one side is posteromedially the extensor pollicis longus, anterolaterally is abductor pollicis longus. What is the floor is formed by? This is the radius bone, scaphoid bone, trapezius bone, and the first metacarpal. So base is formed by, or the floor is formed by radius, distal part of the radius, particularly scaphoid, trapezium, and first metacarpal. So that is why if there is a scaphoid fracture if present, then there will be a tenderness over the anatomical snuff box. That was the clinical question that we had already discussed it. And whereas the roof is formed by skin, superficial fascia, and in the superficial fascia we have two structures called as cephalic vein and superficial branch of radial nerve. Superficial branch of radial nerve. This is what the roof. And finally the content. What will be the content? This is a majority people will confuse the cephalic vein, will say as a content, superficial radial nerve some say as content. So it's not that, it is the deep branch of radial artery that is content. It is a deep branch of radial artery. Radial artery is a content, but which branch? Superficial or deep? Deep. That forms a deep palmar arch while it going in the hand. That's about the anatomical snuff box.